Can therapists incorporate the religious beliefs of their patients to help in the healing process?
We're getting into such an interesting area, and it's one that I've come to late in life. Can the therapist help his or her religious person recover their faith and use their religion more effectively, even if the therapist doesn't share that religion or is an atheist and is not religious at all? And can the professional practitioners, the pastors all over this country and all over this world, learn about PTSD and be more effective in doing what they do to heal and to help? And I give an enthusiastic yes to both of those questions. And let me explain a few of the features. First of all, I want to give credit to an unusual medical student at Michigan State University named Robert Libril, who came to me after he had completed his training at the Princeton Theological Seminary and said, I want to work with you. I want to learn from you. I want to become a psychiatrist, but also a pastor who deals with trauma. So Robert has joined the Michigan Victim Alliance, and we've been working together. And there are members of the Michigan Victim Alliance who are active in their religious communities and have been badly traumatized. And some of them have felt that their churches helped them enormously, and some felt the church let them down. So we're working on all of this together. And what we're going to do is have several large regional meetings with clergy people from different religions, including Muslim, Protestant, Jewish, Catholic, and different denominations, come together with people who've experienced trauma and with experts in working with trauma. And we're going to find our way. I don't want to claim that we have a specific roadmap, but we're going to work together on this. Now, I've had a few patients recently who are religious, and their trauma therapy with me dealt in various ways with their religion. Let me tell you about Terry. I'm not going to mention his last name, but that is his first name, and I think he'd like an audience to know what happened. Terry is a Vietnam veteran. It's 40 years, literally 40 years after the horrors happened to him. And the worst was after he had been wounded and could choose to return to the front, he chose to go to the front. He chose to go to the front because he thought his father would feel better if he had, and he actually thought if he had gotten killed, his father would have appreciated that. And looking back on it, he knows this is really not the correct kind of thinking, but that's what he thought at the time. And he convinced his best friend, Billy, to go to the front with him. Both Billy and Terry had been injured. Both of them were offered safe places behind the lines. They both went forward. And Billy was shot and killed. And Terry was there when it happens. And Terry feels so guilty about going back. And in his mind, he caused Billy's death. Well, Terry's a very religious and a very spiritual man. And in the course of our talking about this, I said, Terry, do you really think that according to your religion, you determine how long somebody lives? And he kind of smiled. He said, no, that's way above my pay grade. There's someone up there who determines how long someone is going to live, not me. And then we talked a bit about birth and rebirth and whether crucifixion, seeing a crucifix and a crucifixion scene makes a religious person feel horrified or feel some more profound and positive feelings. And all of a sudden, without my knowing that this was going to happen, Terry said, oh my, are you saying, is it true that actually I was there when Billy was delivered? I was a witness. I was a friend as Billy went through the last moments of his life. And in fact, I served in a good way. Well, we went through that experience in therapy together, and I believe it was, from my perspective, it was psychiatric, but from Terry's, it was religious. And he had kind of a revelation in his thinking and a confirmation of his faith and a feeling that he had served. And he said, look, Doc, I don't think this means that I'm finished. Let's see if this holds up. But I've seen him weeks and months later, and it has held up. And his survival guilt is considerably diminished. He still has some of it, but it's diminished. So I would offer that this is an example of psychiatry, post-traumatic therapy, and religious belief working in concert. And I've explained this to some religious leaders who say, yes, this is a good example of something that we can do, that we can work with. And I think Terry will want to come to that meeting we'll have in Michigan, where the therapists and the survivors and the religious leaders are there together. I always try to understand my patients' religion, spirituality, the role it plays in their life. And of course, I see a wide spectrum. I'm working with somebody now who is recovering from painkiller drug abuse, who was seriously hooked on Vicodin, and from alcoholism. And he's okay now, but he's Catholic. He's carrying a big burden of guilt. I don't believe for crime, but I do believe for feeling that he strayed, he sinned, and he let his family down when he was addicted. He's quite an accomplished worker in his field, and he's made a lot of money and he's lost a lot of money. And so we talked about whether confession and whether having a conversation with a priest would be helpful. He is sure he's bound for hell. Now, I'm not one who believes in hell, but I respect that he does. And I told him maybe all that we're doing is a prelude to your having a much, much more important encounter with a priest, more important than having with this psychiatrist. And we smile about that, and we know that we're different. And I'm looking forward to his getting to the point where we can have that meaningful conversation with a priest. I'd like to talk to that priest. I know there are priests, I've met them, who deal with people like my patient very effectively. So that's an example of somebody like me, a non-believer, believing in those who do believe, and believing that therapy legitimately includes helping someone like this make it to the next step. Now, part of what I'm doing is I'm being very careful that he can commit to sobriety, and that we are doing everything possible to improve his chances of being sober for the rest of his life. And I'm carefully assessing his levels of anxiety and of depression so that those are treated adequately. And all of this helps. But isn't it interesting that for some people, it's that last path, and it's a spiritual path, and it has to be true to their own faith, their own beliefs, their own culture. And when they make that final successful move, the therapy is concluded.